Assalamu alaikum, the communication day. First scenario, Mr. Smith, an 80 years old man admitted due to community-acquired pneumonia. He was previously been diagnosed with bronchiectasis following protocol guidelines of the hospital. He has been treated with penicillin and clarithromycin, which initially helped him to improve. However, a few days ago, he began to experience severe bloody diarrhea. Tests have confirmed the presence of C. diff toxin in the stool. Despite best efforts, diarrhea hasn't shown signs of improvement. Given Mr. Smith's age and overall health, he is in a fragile state and his prognosis is guarded. Your task is to speak with his daughter, Mrs. Anna Smith, and provide an update on her father's health and address any concerns. Ready?
Yes. Hello.
Yes, here you
Hello, doctor.
My name is Dr. Suzanne. I'm one of the doctor in the clinic today. Am I talking to Miss Anna Smith,
Yes, doctor.
daughter of Smith, 80-year-old?
Yes, doctor. Doctor, are you the doctor managing my dad?
Yes. Yes. Today we are here to discuss some issue related to your father condition and address your concern. Is it okay with you?
Yes, doctor. Are you the doctor in charge of my dad's condition?
Yes. Are you next of kin of him?
Doctor, I'm not happy. I just came into the ward and I noticed that my father was not where he used to be. And I checked and I saw him in the private room. As soon as I'm about to enter, one of your colleagues hailed at me and told me to wear my mask. It was unusual, doctor. I'm so angry, doctor.
Uh, Sorry. Can you repeat what you say? Sorry,
I said
I
that as
didn't.
soon as I came into the hospital to see my dad,
Yes.
initially I met him on the ward with other, patients. But coming today, I noticed that my dad has been taken to another side room where he was left alone. I was about to go into the room, and one of your colleagues said I should not enter without wearing a face mask. What has happened,
Oh,
doctor?
I highly appreciate your concern. I'm sorry for what happened. Uh, uh, mm, can I, before we start, your concern is valid, but how much you know about your father condition? How
Eh,
much you know
Actually, doc-
about your father?
actually, doctor, my father was not fine. He was having a chest infection some few days
Yeah.
ago. I brought him down to this hospital. I came in 3 days ago. He was getting better. I was happy. Not to come today to notice that he has gone down significantly. He's now in a special room. What is happening, doctor?
Yes. Uh, uh, You are right. As you mentioned, your father has a chest infection, severe chest infection, and has been treated with medication, antibiotic called penicillin and clarithromycin. And unfortunately, developed side effect of this drug, penicillin, infection called Clostridium difficile toxin. This is infection come mostly after using of antibiotic, and already your father has a severe chest infection and is fragile. Unfortunately, his condition is deteriorated. That is what
Doc,
happened.
doctor,
So sorry for what happened, but this is mostly happen with this medication as
so
a
so
side effect.
so doctor, in
Yes.
fact, you are getting me more confused. My father was sick. He came back. He was getting better. You people gave him an injection, and the side effect of medication has made him look, so down like that, so downcasted like that. Is that what you're telling me?
Yes. Yes. Sorry for happen for your father. I highly appreciate your concern. But this is sometimes happen like side effect of the medication. This is not like a mistake, but this is a side effect of the medication can happen for some patient. And mainly your father is elderly and has like severe chest infection. And already severe chest infection in elderly, as you know, is serious and can be fatal.
Doctor, why didn't
Yes,
you people tell me or my father about the side effects of this medication before giving him? Why?
because side effect can happen in some patient and in some patient cannot happen.
So,
So yes,
so that was the reason why you did not inform me or my father. I'm going to report. I'm going to report this case, doctor. In fact, I want to speak to your consultant for this. Who is the head in charge of? I have to ensure that you people we go down the drain for causing this havoc on my dad without even informing us about the likely
yes,
side effect of this medication.
I highly appreciate your concerns, and I am sorry for what happened for your father. But this is, as I mentioned for you, this is uh, cannot be expected before given antibiotic and can be happen normally as side effect of the drug. And as you know, side effect can happen in any patient, and this is not a mistake. We will do our best to keep your father in a good health.
Doctor, I said I want to report. I want to make a case.
Okay, you can make a report, but as I mentioned for you, this is not a mistake from team or from treating team or doctor. This is only, as I mentioned to you, normal side effect can happen for anyone. That we will
So
do.
doctor,
We will follow him. We will keep him in our eyes, and we will follow him, and we will do our best
so
to
doctor,
save
what
life
is
of your brother.
as he is now? What is the next step from now?
Uh, we will follow him, and we will treat him, and we will do our best for
Doctor,
your for yes.
will my father be
Yes,
cured of this old condition that he is now?
yes. Now, condition, unfortunately, your father now is already fragile and has a severe chest infection and got side effect of the penicillin medication. But we will
Doctor,
we will support him. We will give IV intravenous fluid for this diarrhea, for this loose motion, and we will support him, and we will do our best to save the life of your father.
doctor, why is
Yes,
my
tell
dad
me.
kept in that lonely place, in that secluded place, in that private side? Why?
What
Why is my dad kept in that lonely side room alone
is kept alone in?
2 minutes
private
left.
room? Why? Why is my dad kept in that lonely, quiet room alone without no
Because
other
yes,
patients
yes,
there?
because your father condition is the serious and your father is a fragile, so should be keep in highly intensive care room. Okay, for more care. This is something good will be for your father because we'll give him more care. Can I ask you some question?
Okay, go ahead.
Who is caring of your father?
Who's caring for my
Your
father?
father, yes, your father is financially supported. Who is support him and
Okay, okay. Come again.
yes, I am asking you are who is supporting your father? Your father is financially support. and you are caring of him. Who is caring of your father?
I'm the one caring for my father now. I'm the one.
Nice, what you are doing, and I appreciate what you are doing. And your father is a smoker,
No, no, it's not. It's not.
alcoholic, drink
No, it's
alcohol,
not. It's not. It's not.
or not drink alcohol. Okay, okay. Uh, have you have any concern?
Doctor, like I said, you said my father is put in the side room, and I've said,
Yes.
am I supposed to go and see him regularly as he's there now?
According to your condition, I will check with the consultant. If there is a chance, you can see him. But as I mentioned to you, his condition is serious and should be kept in highly intensive care unit. And this is something good for your father to keep him safe.
Okay, thank you very much. Thank you.
Okay, the time is up.
Thank,
Thank you, Dr.
thank you,
Salma.
thank you.
Dr. Hinari will comment, then I will comment.
The she in fact the scenario was a good one. You started well. The patient was angry that the father was being kept in the side room. However, you how will I put it? The link was not really there. You apologize for yelling for them, your colleague yelling at him. However, you didn't really, how will I put it now? You didn't how will I put it now? The You didn't relate well with him. You didn't really. He said he wanted to complain. You didn't tell him about how pals can be of help to him. He did not say that, definitely. And these are some other things I just feel that is really wrong with the communication. But however, you did very well. It was a good one. Thank you.
Thank you.
Okay, thank you, Dr. Hinari. But I have more comments for Dr. Salma, maybe because she's
Yes.
first time to practice, but it's okay. She will learn from this practice.
Yes.
Yeah, so it's sympathy and empathy is a must in any scenario. So you have to be sorry all over the discussion. Okay, you are sorry whatever he's angry, whatever he is, someone is irritating you. I want to report. Yes, this is his right, and as Dr. Mehnari said, take it as a reaction with calm way. I'm so sorry for your feeling, because he even if this is a complication or side effects, even it's something expected, but he shouldn't expect it. Okay, so what you have to do, I'm so sorry for feeling,
Mm.
I appreciate your worry. Yes, it's your right to do any report or complain, and I will guide you to the office response for that. So this is very important, and it might minus you as a welfare, the way you talk to him about the reaction or to complain to the you didn't even mention the office. So if you want to complain, it means that, or it sound that if you want to complain, okay, complain, I don't care. It sounds like this exactly. So the best way
Mm-hmm.
is to be very sympathetic with him. I'm so sorry for your feeling, and reduce your tone. Don't raise your tone against him. So it sounds that you are fighting with him or confronting him. You want to complain? Okay, go and complain. No, it's the way how to absorb his anger. Please, I'm so sorry for your feeling, and let's do whatever you want to tell. Okay.
Mm-hmm.
The second
Okay.
thing, what I want to comment on, the complication. It's not commonly happen. You said it's commonly happen or mostly,
Mm-hmm.
right? But if
Yes.
you check the rate, it's not that much high. So and it's not expected. Not every patient you give them this medicine, it will give you the Clostridium difficile or pseudomembranous colitis, right? It's something
Mm-hmm.
rare. if every patient will take this medicine and they will develop this condition, the medication will be stopped, or I mean prohibited. But some
Mm,
patient, which is very few percentage, they might have this percentage of having this complication. Is it serious? Yes, one of the serious complication. It might threat the life,
mhm,
particularly if there is frequent bloody diarrhea. Okay, what is the main
mhm.
task in this scenario? The patient is deteriorating,
This is
not improving.
sorry, Dr. Basim. This is
Yes.
mistake. This is
No,
mistake.
no, no. I'm not
This
talking about
medical.
mistake. No, no, no. It's not mistake. Yes,
Ah,
it's
yes,
complication, but you make it
yes.
as a
I mean, يعني if we mistake, I will say I am apologize.
no, 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 no. Don't apologize. I didn't say you have to apologize. I said the percentage or the way you talk about this complication sound that it's very common, which is not very common. Okay.
Mhm.
But
Okay.
you have to be
Okay.
sorry for him. I'm so sorry for for your father suffering. I am so sorry if you understand like this. Okay, so try to absorb his anger by saying sorry, but no apologize here. Once he mentioned that no one informed me about this side effect, here you might say I apologize for that because
Mhm.
it's our habit. We used to explain the benefit and the side effect of every medicine, and
Mhm.
eventually, we might do so for your father or with your father. We might explain it. Maybe he wasn't there. So you can say, usually, we are explaining this side effect to our patient. Okay? But if he said, no one informed me, be sorry for a while. I'm so sorry for that. I apologize for this if this happened. However, we used to explain every side effect to the patient. Full stop. One more point here I want to stress on it, the smoking and alcohol. Whenever you are talking to a daughter or to a son, don't ask about the father smoking or alcohol. Okay?
Mhm.
It's
Okay.
something to be
Okay.
discussed with the patient only, the patient himself or herself.
Okay.
The last
Okay.
point
He's
is
caring about like this.
no, it's like,
Social هنا بكون how social history will be
yes,
for
I will
this.
ask you, yeah, another comment and advice. Whenever you are providing support, you are not providing the financial. You are supporting the patient, everything, not only financial. So don't mention
Mm.
this the financial as a support he needs. No, any kind of
Mm.
support he needs. Why? Because you are
Mm.
not giving him money. You are not going to give him money, right?
Yes.
What you want to give him or what the patient will need from you, some
Care.
tools, some care, some tools to help with coping with his daily activity, oxygen, medication, but he will not take from you money. Okay, so don't ask about the financial support. It's not something to be offered from you or even social worker. It's not our service. We'll not give the patient money.
Okay.
Okay, it could be by
Yes.
charity or someone else who's responsible for this support, this kind of support. But what he needs at home, and we should provide it, the social, the medication, the occupational, some tools he needs at home, aids, stick to walk with. But again, the main task in this scenario that the patient is deteriorating and he's not going to the ICU. He kept in the aside room, which is isolation room, not because of
No.
okay, yeah, it's that's why
Okay.
another also different point. So he kept in aside room for the infection disease he had. It's
Mm.
something to be spreading if we couldn't isolate him. If we couldn't isolate him, or if we wouldn't isolate him, this infection might spread to other patient or to even the family. And we are careful about this thing. We inform the infection control team in the hospital, okay? Because it's something need to be isolated and reported. It's not
Mm.
easy thing. It's very severe condition which can affect the patient as well as other patients. So even breakthrough the hospital or outbreak in the department, and this is against the infection control. So we have to keep him in isolation room, not as ICU. Okay.
Oh, okay, 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 okay.
Another
Okay.
another point which is the palliative care. I think this scenario supposed to explore the point of palliative care. Your father kept deteriorating despite of the medication, despite the antibiotics, and this condition now might threat his life more and more. And the medical team decided that he's now for the palliative therapy. Have you ever heard about it? No, doctor. What's the meaning of palliative? It's a team of doctors that, or group of doctors that they will take care of your father not to have any pain or infection or low mood. Okay, will take care of these things. So we will treat his condition according to his need. Okay, by the way, also you have to mention the way how to manage the Clostridium difficile. You mention it, some medication to be given through your blood channel or through his blood channel, but not as, don't say IV fluid, intravenous fluid. So it's a matter of medication to be given to kill this bug, which is usually not toxic, but in your further condition, because his immunity or his defense system is weak, it become more dominant and the manifestation appear. Okay, so the scenario totally from the start will be drive differently. Maybe you misunderstand the scenario, but this is the way of this scenario, how to deal with it. Okay, the next of kin point already you started with. Are you the next of kin? It's a good point to ask. And the introduction also tell me what you have, what you know about your father condition. All of these as introduction, very good. But the way how to manage the scenario of Clostridium difficile by this way: isolation. Even the visitors may be restricted, or if they want to be inside, they can use some precaution. And the patient, if the condition is deteriorated, we might talk about palliative, and infection control also should be informed. And the patient, as I said, will be isolated or in a side room. At the end, 2 minutes left, ask about the concern and the support. Okay?
Okay.
Okay. Well done, Dr. Salma. You kept fluent all over the scenario, which is very important. Don't be hesitant to address any concern or to answer any question, which is good. But how to answer and to address the concern just need some experience, and you will be professional after that.
Inshallah. Thank you very much.
Okay, clear? Yeah. Okay, let's go to the comments. Dr. Ayula, are you there?
Yes, I'm here. Okay.
Okay, I will read the comment. Be ready. We will discuss the concern with you.
Mm-hmm.
Okay, just give me a while. I will read the scenario also for Dr. Henry. Dr. Henry, your scenario. Mr. John, 28 years old, present with fatigue with and weight loss, fever for 3 months. 3 days later, report headache and photophobia. Examination show meningeal irritation. Diagnosis of neurobrucellosis. Okay, neurobrucellosis suspected and infectious disease. Physician requested for LP tests for brucellosis in CSF. Mr. John was informed about the disease, sit with him and take consent for lumbar puncture. Okay, quickly I'll read the. Okay, let's discuss the concern with Dr. Ayula first, then I will read other comment. Dr. Ayula, the first concern: I found my father in a side room. How to address this?
Okay. Yeah. Raising this with me. Yeah. Usually when things like this happen, when patient comes down with this super bug like your father has done, what we normally do is to move them to the side room. And this is because we want this infection can spread to other patients, and we prevent this from happening. But not to worry, your father will be closely monitored by a nurse. And I don't want you to be surprised when you see us going in with protective equipment. This is just to prevent the spread of this condition to other patients.
Yeah. So, what about the beginning of your talk? Will you answer it quickly,
I
or
think
what
I
you
think
should say? Yeah. When I say to you, I came here today and I found my father in a side room.
mm,
What the first answer in the first moment? What you could say?
you appreciate his concern.
Yeah.
Appreciate,
So
yeah.
yeah,
So I said I said thank you for raising this with me. Is that not or
yeah,
okay?
exactly. Or I'm so sorry if you find your father in a side room. So first of all, you have to appreciate and to be sorry for his feeling that he found his father in another room or he is in an isolated room or whatever. Okay, the next concern. Why no one tell me about his side effects? How to say or to answer it?
Okay. Well, I appreciate your concern, and the question is quite important. I want to reassure you that no, usually before we start treatment, we discuss the benefit and risks of each treatment, which I believe this must have been done in this case with your father before commencing these treatments for. Okay, how
Yeah,
does
perfect. It sounds good, doctor. Doctor, I want to meet your consultant.
Yeah, I quite appreciate your feelings, and anybody in your shoe would have felt this way. But I want to assure you that I would I would organize a meeting with my consultant to have a discussion with. How does that sound to you, Mr. I've forgotten his name, Mr. Smith?
Anna, she was Miss Anna. Okay.
Miss Hannah, yeah.
Yes, doctor, it's okay for me. I need to sit with him as soon as possible. Next,
Mhm.
doctor, I want to report what happened to my father.
Okay. Yes. Anna is a good. Well, I appreciate that you are expressing me one more time. Well, we can. If you want to report, I want to assure you that it's your right to report, as this will give you edge on to know exactly what happened, and I will support you as much as I can. I will give information about an organization, and I mean a body called PALS, which is patient advice liaison service, who would discuss this with you further. But I want to reassure you that if you take this step, it will not in any way affect the care that we are giving to your father. We'll keep monitoring him and give him the optimal care in his best interest.
Yes. Would this affect my father care, doctor, if I complain?
Oh, absolutely not, Miss Hannah. We will keep monitoring your father and we'll support him as much as we can.
Perfect. Okay, what's the next step, doctor, in his condition?
Okay, the next step to do for you first, I want to let you know that we've stopped the antibiotics that have caused this. And we've moved into to the side room to isolate him, as you are aware of this. And then we've commenced another antibiotics to fight this super bug that he has. And then we'll keep to support him with some fluid, which will be giving him through his blood channels. And we'll monitor him closely, and then we'll take it up from there.
Okay, perfect. Thank you, Dr. Ayola. Don't forget, in general, as written there in the discussion or in the scenario, that his condition deteriorated and
Okay,
no
I think.
improvement. So, yeah, so you
Okay.
might yeah, decide or to talk about the palliative in brief way. Okay.
Mhm.
Okay. Thank you, Dr.
Sorry,
Ayola.
Dr. Basim.
Yes.
Sorry, can you answer for me the question why you didn't inform me about side effect of this medication? How I will answer
Yes.
this?
Yes. I appreciate worry, Mrs. Anna. Usually,
Mm,
usually, and this is our habit. And we used to explain the side effect of every medication before starting it to any patient.
mhm.
In your father condition, we have a sit with him and we have a meeting explaining everything about the medication, the benefit, and the side effects. Okay, if she said no, doctor, he said no, or no one told him about this or anything else, like no one, or she denied that, so you can apologize and you can say, but I'm so sorry for that. But usually we are doing this. Okay.
Okay, okay, thank you.
Yeah, but you have to be sure that this meeting or this side effect wasn't mentioned to his father or her father, but supposed to be informed. So assume that we did that as our habit. Maybe she doesn't know, but it's not our task to tell the next of kin or to explain the side effect to the daughter or to the son. We are sitting with every patient. If the patient himself told you, doctor, no one said to me any complication, this is a mistake. Okay, you have to trust the patient. No one informed me, doctor. I'm so sorry about that. I apologize on behalf of the whole team about this mistake. It's supposed not to happen, and it's not intentionally happen. And we will report that to know why, what happened exactly, why you wouldn't inform about this side effect. Okay.
Okay.
Okay. Thank you, Dr. Salma. Be ready for the next scenario, but I will read the comments and the chat box quickly. Dr. Ibrahim Ashur, your father got bug that might spread to other person. That's why he was kept in a side room. But be sure that we assign the staff nurse to take care of him. Perfect. This is another way to address the first concern. We kept him in a side room, yes, but we will take care of him. He's not away from us. We kept monitoring him, and we assigned a special nurse for him to take care of him. Ibrahim, Dr. Ibrahim, again, you have the right to set a complaint. Yes, exactly. And I will show you where to fill this form in the patient advice license services office. And be sure that this complaint will not affect his care or our care to your father. Perfect. This is another way also to reassure. Uh, Dr. Ibrahim, better not to say, does he smoke exactly? Instead, does he smoke or does he is a smoker? Okay, but anyway, you will not ask this question. Agree, Dr. Ibrahim? If you are talking to the patient only, you can address this issue. Otherwise, you have other tasks to talk about in this scenario, which is not, you will not have the time to talk about smoker. But it's an accepted idea to ask, does he smoke, rather than saying smoker. Okay, does he alcoholic? Yes, alcoholic is very upset word. Some patient will not accept, some examiner will not accept it. Alcoholic means the patient is having alcoholic toxicity or alcoholic dependence side effect. So you have to say, does he consume? Does he take alcohol? But don't say, does he or is he alcoholic? Okay, so there is definition of alcoholic, which is different than asking consuming alcohol. Does he drink alcohol? Exactly. Antibiotics and antibug, exactly. So it's one of the jargon. Don't say antibiotics. Dr. Ibrahim again, I saw one doctor enter the room without face mask or stuff without wearing gloves. This is a very fatal mistake from our staff. So, Dr. Ibrahim again, these measures are very important and we will follow the infection control measures to prevent spread of such bug. Okay. So you are talking about the precaution someone didn't take or didn't follow it to prevent spread of such bug. But from our side, we will write incident report. Perfect. Inform consultant, inform safety management risk team. They will discuss the incident and will inform us about the result and recommendation to prevent this from happening again and again. Yes, perfect. But instead of informing the consultant, if he's a doctor, inform the consultant. If he or she is a nurse, inform the nurse supervisor. Okay. Thank you, Dr. Ibrahim, for addressing the concern which we didn't discuss, or even we discussed, you repeated them to be clear for all. Anyone with question before moving to the next scenario? If no question, we can move forward. Dr. Salma and Dr. Hina, ready?
Yes.
Yes. Here you go.
Good morning.
Good morning.
I'm Dr. Henry, one of the doctors here. And may I confirm you are Mr. John 28 years old.
Yes.
Okay, actually, I've come to discuss with you concerning your health condition. If I may ask, is this place convenient for us to have this discussion, or you want somebody else, your loved ones, to be around with you? I will discuss.
It's okay, no need.
Thank you so much. Just to ensure that we are on the same page, can you please tell me what has been going on with you in terms of your condition up to this very time?
I have fatigue and weight loss and fever for around 3 months ago. But now, before 3 days, I develop headache and I cannot see good. Uh, and doctor it informed me that he want to do for me uh, something test in my back. And he want to take sample from my back. What is this?
Oh, thank you so much. Actually, I first want to really, I can imagine that you have been going through a lot of pain, with the headache and the feeling of weakness and everything. But how are you feeling now? Are you better?
Yes, that.
Oh, okay. Thank you so much. Actually,
Thank you.
the test that you are told about is actually a procedure that is called lumbar puncture. Have you heard of that before?
No.
Okay, thank you. I'm going to tell you what it entails. Actually, it's actually a procedure whereby we take fluid from your spine, at your back. We get a small fluid from there, then take it to the lab and see if what we are thinking is what you have. Actually, to to be to say it more, it's just like it's a common procedure we do to patients who have similar condition with yours. The procedure involves us taking them to the procedure room. Usually, the whole of the procedure doesn't last. It can take up to 45 minutes or sometimes up to 1 hour if it's too. But if it's too, long, we'll place them in the side room. But before then, usually what we do, we call some doctors that are in charge of numbing you so that you not feel pain. They also ensure that you are not at risk of bleeding by doing some tests, to test if you are at risk of bleeding or not, and then see if you have all if you don't if you are if all the if everything are in place. If you don't have any risk of bleeding, they'll put you in the side room. Then they will numb you that area at the back, ensure that it is kept clean. Then a needle will be taken. It will pass through the needle, a very thin needle will get to your backbone, and then the fluid will be taken from that. And after the fluid is collected, we'll put the fluid in a small container and send it to the lab. Subsequently, we need to.
Is it
Um,
serious? You will open my back? Is it serious?
no, no,
I am afraid from this procedure.
I can imagine what is going through your mind now. Actually, I don't mean opening your bag. I said just the way you use needle to take blood from your blood channel in your if you want to give you fluid or if you want to give injection. That's the same way we take the same needle but this is a more specialized needle, very tiny, to just pass through your back. It's usually a very painless procedure, but sometimes you may feel some a little bit of irritation, but not to worry. We'll be there to ensure that you are safe. After doing that, we may need to seal that place up with plaster or with tape. Then you'll be allowed to rest for a while, let's say for about an hour or two or even 3 hours. You lie down on your back, and then subsequently, if we find that there's no other thing um, thing that occurs following, then we need to discharge you subsequently. Then it's all take you back to your ward and then start the treatment if the result is out. However, there are certain complications that may arise from the procedure. usually it might have
What
some
complication? Any complication, serious complication can happen for me?
Yeah, that's a good question. Actually, the complication might ranges from pain. Some people tend to feel pain from that side, despite the numbing agent that they place there. Some persons also tend to have some small bleed, so the bleeding can be also, increased depending on if it is not well attended to. But not to worry, we'll do well to address that. And some persons also have headache following the procedure, but we'll try and ensure that we follow the rightful procedure to prevent that from occurring. And sometimes some person might also have what they call some blood clots might form in the process, and sometimes some might have some.
What I will do if I got this headache? Is it serious?
That's a nice question. Like I said, we will try as much as possible to avoid that. But if eventually in your own case you have that headache, we'll put every place in order. We'll ensure that we manage the headache with you and support you in every step of the way. Is that okay?
What other complication can happen for me?
Also, thank you very much for that. Other complications, like I said, we include, some person might have infection from that site, but in your own case, we ensure that we do a clean procedure to avoid that from happening. So all these are some other complications that might arise from that. But not to worry, we'll ensure that because we have been doing this procedure multiple times, and we ensure that we follow the same clean procedure in attending yours too. Is that okay?
Okay.
Okay. Do you have any other concern?
Only my concern that I am afraid it may be serious or uh, may I got any problem in my leg after this procedure.
Thank you for your concern. It is common, or it is normal for you to be feeling anxious about your procedure. However, I want to assure you that we'll do our best to ensure that this complication I mentioned will not happen in your own case by ensuring that we put in place all the safety procedure to ensure that the procedure is calm and safe. Is that okay?
Okay, thank you.
Do you have any other concern?
2 minutes left.
No, thank you.
Okay. Sorry if I may, just to ensure that we are on the same page, I want to summarize what I said, to ensure that we're on the same page. That you'll be given a procedure which will be taken from your back. Initially, will be collecting, and then subsequently we'll take it to the field to the lab to also. The essence of that is to get the right diagnosis for you. However, if there are certain complications that might arise, in which I told you, such as bleeding, pain, and some infection, but we'll do it to attend to that. And also, just to ensure that you have agreed with me, will you be willing to sign for the procedure?
Okay.
Okay.
You will give me a paper to sign?
Yes. Yes, this is a paper for you to sign. However, be rest assured that if anything goes wrong, we'll be here to support you to ensure that things things will go on well with you. Is that okay?
Okay.
Okay, so you can sign here, and then subsequently I'll give you a leaflet. This is a leaflet. You can read about the procedure too. And at any time, feel free to object if you don't want to go ahead with the procedure. You're always welcome to help to support you in every step of the way. Thank you very much.
Thank you.
All right.
You have 30 or 20 seconds now. You want to address anything?
And also, if I may ask, actually, there's still other. In prevention, this procedure was not successful. There are other alternatives that we can also do in if other needs arise, which may include a brain imaging test, which is called the brain MRI. That's what we call it. But however, this is what is requested for now. And just rest assured that peradventure we didn't see something like you may want to do something else if the result is not being given. Is that okay? All right. Thank you
Okay.
very much.
Yes.
Thank you.
Okay, well done, Dr. Henry. The comment now, Dr. Sama, please comment, then I will comment.
Okay. Maybe I'm not so experienced to comment,
Just,
but
fulfill,
only
yes.
one point that if draw, tell me I will draw for you this procedure like this will be more easy.
Okay, what else? What he missed also? What do you think, the other comments?
Other social didn't ask me about any social history.
What else? What do you think the way he took long? Do you think he took long time to explain without asking your
Yes,
understanding?
yes. It's tell me everything without ask.
Yeah.
Yes,
So
yes.
I agree with this. Any other comments? Because I will comment to that. Any other comment, Dr. Salma, or I will
No,
start?
only these three.
Okay.
Only these three
Yes.
comment. Okay, thank you.
Okay. Yeah, thank you. So, Dr. Henry, well done in general as a procedure, but my concept, my concept that you are really not giving chance to the surrogate to talk. Okay, this is the first concern. And first advice, try to stop in between. Even if you want to explain lengthy, take your time to explain, but please stop in between to ask if he following you or if he's understanding what you are saying. Okay, but don't tell him, do you understand? So, am I clear so far? Did you get me? Okay. I think you kept talking for 4 minutes, explaining the whole steps without even stopping for a second to ask him if he is agree or if he is following you or if you are clear with him. So take care of this. It's very fatal mistake. What about the steps before and during and after the procedure? Did you follow?
Yes. I think I told him that we have to numb the back.
Yes. See, you remember now
Us.
the steps.
Yeah. I told him
So
we have to numb
means,
the back.
yeah, means that you didn't do it. The numbness, the preparation, the position, right? The
Yeah.
area where the snip will be done. Okay, all these steps should be filled during talk, and even you can do it in steps. So before the operation or before the procedure, we will be sure that you are ready by doing some blood test. Is that okay for you? Yes, doctor.
Yeah.
And during the procedure, you will be kept in a room, clean room, and we will clean the area that we will go through it by a small needle. You can draw, of course, as Dr. Selma said. Throw that by this needle, it will go easily, smoothly after numbing the area. Don't worry, we are taking care of this. You will not feel pain. We have our pain doctor. He will be attending there to be sure that you are not feeling any pain. After that, after getting the snip from your back, we will send it for analysis, the fluid for analysis. Then, after the procedure, we'll keep you under monitoring. We advise you to lie flat in order not to have a common side effect after this procedure, which is headache for a few hours after the procedure. And we will take care that you don't have any bleeding from the site of the needle. There is some complication might happen, unwanted effect, which is not common. Why? Because we have expert team. They are doing this procedure many times or multiple times. some of these complications could be the headache, as I mentioned, if you didn't lie down for a long time. Sometimes either injury to the nearby organ or areas. So 2 eyes, 2 P's. I always remember these, and that's enough. Don't remember others, unless there is specific procedure. 2 eyes, infection and injury, and 2 P's, pain and bleeding. And we will try to avoid this complication by preparing you well and involving a group of doctors. They are expert in this procedure. Is that okay for you? Yes, doctor. How do you think about this procedure? It sounds serious, doctor. I'm so sorry to feel that. I will reassure you that it's happened many, many times, and our team are expert in this. You have other concern? 2 minutes left. You can ask some social support, but don't forget the consent. If you are agree, please, there is a consent form. It will be given to you, and read it carefully. Whenever you are ready to sign it, please, you can sign it. If you have any time to withdraw, it's your right to withdraw anytime, at any time. Okay? By this way, you kept at least summarized, and keep every now and then asking if he's understanding or if he's following you. Am I clear? The drawing also will be much great if you do. Just draw the needle and the back and the sitting, for example, position. And the needle will go through the layers, reaching to the area of the fluid. And after that, we'll get some of the fluid, sending them for analysis. And please, if you want to address a concern, ask him earlier, after introduction, at any time. You have any concern, please stop me. By this way, even if you keep talking, he will stop you. Please, doctor, you said to me if I have any concern, and I have concern. Even if he didn't do so, you show the examiner that you are preparing him to ask any concern at the beginning. I prefer to do this because it's like showing the examiner and paying attention to the surrogate that you are ready to hear any concern at any time. Okay?
Mm.
Please, Dr. Henry, try to be listener, not to be talking. Even if you want to explain a procedure, I know it's a matter of time, I have to, but sometimes it's not necessary compared to the concern the patient or the surrogate is having. Sometimes they need to ask you more, and they don't care about these steps. They are caring about the complication, what will happen. Okay, so you have to be ready to address the concern and to answer the question rather than explaining. Yes, the task is to explain, but you will have time to explain. Try to do it in an organized way before, during, and after, and give him the time in between to ask any concern. Okay?
Okay.
Yes. Thank you, Dr. Henry.
Thank you.
Any
Thank you.
question, Dr. Henry or Dr. Salma?
No.
Anyone has concern or question? The procedure as a scenario of communication is good scenario because you know what you have to do. Nothing will be hidden. Everything
Yeah.
clear in front of you and him. Procedure steps during and before and after. Some complication, the consent form, and the social support. That's it. It's not common to have a hidden concern or something will happen. Maybe there is a hidden concern like, will I fly after that? It could be difficult for you, but as Dr. Henry did, or as anyone can do, you can refer to the consultant if you don't know the answer. For how long I can keep like this, doctor, in the hospital? I have a flight, I have an occasion, I have an event, whatever he will address. If you are not sure about your answer and for how long this patient should kept, you can say, I will ask my senior and I will be back to you. Or I can ask for the guidelines of the aviation regulation when you can fly, for example. Okay. But brucellosis as an infection, even after the LP, patient can fly easily. I think so. So it's not a matter of prevention of flight. He can fly. But the subarachnoid, it came before as a concern of flight after subarachnoid hemorrhage, when the patient of subarachnoid hemorrhage can fly. Clear now for all?
Yes.
Yeah, okay. Thank you, Dr. Henry and Dr. Salma. Now the time, Dr. Ayula, because I promise her that she will do as a semi candidate today. So this is as semi candidate. I will ask you the two concerns which I wrote. Dr. Ayula, ready?
Yes.
Okay. The first concern, is it serious, doctor?
Oh, thank you for your question, Mr. John. I can't really what is through your mind, but I want to reassure you that this procedure is quite a common procedure, and it's going to be done by an expert. Well, it's going to be done by an expert. We ensure that we follow all the due protocols and also ensure that we reduce the risks as much as possible.
Yeah. So there is some serious effects or complication might happen. However,
Mm,
our team are professional and these side effects is or very minimal or are very minimal, right?
mm,
Because it's serious. Yes, some patient it could be difficult, frequent attempts. Maybe it will lead to to hematoma. Yeah, there is possibility, but it's very few. Okay.
mm.
Okay. The second one, what complication may happen?
Okay. Yeah. Well, yeah. Okay, there are complications that can happen. There are no complications that can happen with this procedure, and one of it would the one that we are quite concerned about is the headache post after the procedure is quite common, but it's something that can be managed. Okay, so we advise you to lie calm in bed. We also give you some killers to help you, and also give you some fluid to help you with this headache, which we hope to resolve within a couple of hours or even days. But if it persists, then we may likely intervene with that. Other possible complications include pain in your back after the procedure, infection at the back as well. You could also bleed, but we ensure that we put every step in place to prevent this from happening. How does that sound to you, Mr. John?
Yeah, perfect, doctor. Thank you. So as I said, and you can start by saying every procedure has its complication,
Mm,
but our experts, doctors, with the expert hand, the complication will be very minimal. Okay, there is complication as you mentioned, and the most common is, yes, I said two eyes, two P's, but please, for a specific procedure, there is specific side effects. For example, if you want to insert a stent by ERCP, what is the most common, and you have to explain it as a complication post ERCP? What is the most the possible complication?
pancreatitis.
Exactly. You should mention pancreatitis, right? Agree? Yes, injury. Yes, there is possibility of injury to nearby organs. There is possibility of infection. There is possibility of bleeding and pain, as every procedure. But confined to the ERCP, pancreatitis, one of the complication might be related only to this procedure, and so on. Okay, so every procedure has its own side effects specific to the this procedure. You have to mention it at the brief as our procedure today. Okay, the headache you have to mention here. That's why we ask the patient to lie down after the procedure for a couple of hours, as you said. Any other question, or do you have any question, Dr. Ayuda?
No, thank you.
Okay, thank you too. Anyone with question? Anyone want to comment or add suggestion? No comment? Okay. Yes, thank you, Dr. Salma and Dr. Henry for participation today, Dr. Ayula as well, and the other Dr. Ibrahim for commenting. Next week, unfortunately, I might be absent for the first days, so we might cancel Saturday, Sunday, Monday session for social issue again. But I tried my best to postpone it. So it's supposed to be this week, but I postponed to the next week. So we will start on Tuesday, long clinical. Then the Wednesday will be short communication. Then the Thursday will be short. Okay. See, see you next week. Sorry. Have a nice weekend. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.